presentation are screening and assessment, appropriate treatment, and post-release planning. Some problem and challenges and statistics related to mental health and corrections will also be discussed. Hi, my name is Carina Velazquez, and I will be discussing screening and assessment. During screening, a test is performed to identify any disorder symptoms and determine whether an inmate needs treatment. This can be done by completing a physical exam and an in-depth interview about one's feelings and behaviors. During assessment, the results of the screening are evaluated and the proper treatment for an inmate is decided. Screening and assessment are effective practices because, without proper assessment, the methods and practices used by the institution to treat the offenders will not be effective. The institution needs to understand what the right type of treatment and programming is first before they can help the inmates. In addition, when officers are aware of inmates' illnesses, they know how to properly approach and talk to the inmates, making them easier to manage. Lastly, screening and assessment helps decrease recidivism in prison populations. After assessment, officers can better plan for an inmate's release back to the community. Better post-release planning helps the offender adjust back into society, making them less likely to return to jail or prison. If it were not for screening and assessment, mentally ill inmates would be receiving the wrong type of treatment and remain being seen as high risk to society. In other words, they would remain in prisons and increase prison populations.
Valdez, and today I'm going to be discussing about the appropriate treatment in correctional facilities. Correctional facilities have been improving their ways to further understand on how to help deal with mentally ill inmates. For example, they are hiring more professionals like psychiatrists or psychologists on helping to identify and treat those with serious mentally ill inmates. They help by making sure that prisoners are taking their medication, so they provide them with mouth checks, which allows them to see inside a prisoner's mouth and see whether or not prisoners are taking their medications or selling them to other prisoners. Not only is hiring more staff who are professional when it comes to medication, it is also important for the rest of the staff, especially the officers, to be aware of mental health. Since correctional officers are with prisoners 24/7, it is important for them to know how to approach them. Therefore, they are working on improving their training by being able to identify the early signs and symptoms for mental disorders. It is crucial they notice things like not eating, not sleeping, or not doing their everyday activities so they can be helped sooner. Officers should not approach to inmates in an aggressive way because it can cause a safety hazard for inmates and for themselves. In fact, having everything being effectively documented over time can show any behavioral patterns and can make it easier for medical professionals to determine whether or not they are showing signs of a disorder and if they need medication or not.
Hello, my name is Joey Soda, and my group's topic is Best Practices in Correctional Mental Health Treatment. My subtopic has to do with post-release planning. So what is post-release planning? Post-release planning is the steps that an inmate takes during his re-entry process back into society following a completed correctional sentence. It is important for newly released inmates, especially those with mental health issues, to seek out these types of services to guide them outside of a correctional institution upon release. Such services can help them find a job, find a place to live, and give them access to many other mental health services such as group intervention meetings with therapists to discuss their ongoing issues. Many benefits come with proper post-release planning, the most important of which is that it reduces recidivism rates. It provides newly released inmates with proper access to mental health services. And lastly, it prepares prisoners for long-term post-release success.
Hi, my name is Kaelin, and I will be discussing problems and challenges, some statistics, and then I will conclude our presentation. One of the biggest problems jails and prisons face when dealing with inmates who suffer from mental illnesses is lack of resources. This includes lack of staff, treatment, and funds. Another challenge institutions face is the cost of housing inmates with mental illnesses. Some things that contribute to this are the fact that inmates with mental illnesses stay almost twice as long as other inmates do. This is due to the fact that they have a harder time following directions and are more likely to have violations. It is also because some inmates require evaluations before their trial, which actually lengthens the amount of time that they are in jail. Some statistics to actually put this in perspective are that 2 million people who are suffering from mental illnesses are incarcerated every year. 20% of jail inmates and 15% of prison inmates have a mental illness, and in 2014, around 383,000 people were incarcerated with a mental illness. In conclusion, screening and assessment helps to identify the patient's symptoms and determine proper treatment. Having the appropriate treatment is crucial and beneficial to the patient. Appropriate treatment means having people experienced with mental health and having well-trained staff altogether. Post-release planning is important because it helps inmates ease back into society. It is also important to be aware of the problem with mental health treatment in correctional facilities, such as lack of resources. And lastly, being aware of the statistics is important as well to put all of this information into perspective. And that concludes our presentation on the best practices in correctional mental health treatment. Thank you.